We have an audience request question. Recently, the Board of Education decreased health benefits for retirees, and in addition, they asked 2 employee groups to voluntarily open their contract to take a reduction in health benefits, and these 2 groups have reopened their contracts for discussion. The benefit changes won't be taking place till January, but the Board of Education did not ask the superintendent to open his contract to do the same. So the question is, do you think the school system leadership should be asked to take on the same responsibility that the various employee groups have been asked and retiree groups have been asked? Mr. Ballinger.
Yes. I think that in these times, leadership shows by example. And when we are cutting what our teachers are getting and our part-time nurses and that are getting because of the raise and the cost of what we're asking them to pay for health care, we all need to feel it. We need to make sure that we're in it together, that we get through these times, and then when we have the ability, we give out benefits, but in these trying times, we stick together. So I'd be the first person on the board to say, you know something, in these trying times, you can look at the piddly salary we get for being on the board. Because leadership is stepping up and being the first to do it. And I think that question is easily answered, yes.
Other response. Mr. Walker, and then Mr. Meshkin.
I agree with Mr. Ballinger. I would say yes. I think it's incumbent upon the entire community in the system to all pitch in and carry the load.
Mr. Meshkin?
I'd like to echo that and build upon it. I think that there's a principle of shared sacrifice. I mean, it's not just the teachers that may be taking a haircut right now on their health insurance. You know, our community is struggling right now. We have record unemployment and those type of things. So I think we need to be sensitive as leaders of the school system to what's going on. I think that's important. But I think, you know, the approach that was taken there was an example of the old adage that you spend more and do more or spend less and do less. And they could have been more innovative. They could have followed the example of the New Hampshire public school system, the University of Louisville, and implemented an employee wellness policy and actually saved more money and put more money in the pockets of our educators and cut the budget. It's those type of things that I'll advocate for as a member of the Board of Education.
Mr. Proudfoot.
I agree that it should be considered. As a school system, we need to send a message, and that message is that we are a family of educators. And I believe that once that message gets out, we can work harder to recruit and retain the best educators and support staff that Maryland has to offer. Actually, the country has to offer. So definitely, I would be in support of that.
Mr. Aquino.
With respect to whether, if the question is, you know, should Dr. Cousin have cut back on his health benefits, I think we're in a slightly different situation. You know, he's a bargaining unit of 1. He has a 4-year contract. Much like other contracts with the system, we have always upheld our contracts. The negotiation with the various bargaining units are just that, negotiations. These are very difficult decisions. I can assure you I wasn't pleased with having to make some of these decisions or voting for them one way or the other. I will also note, however, that senior staff, including the superintendent, did not receive any salary increases over these last 2 years. And that, as a point of fact, we do have a wellness program.
Okay. Other comments? Ms. French.
I'd like to point out that we bargain with the Teachers Association, and so the teachers have accepted 3% more of the burden, so that we pay 87% of the benefits and they pay 13%. Right? And what you were talking about before had to do with part-time, people who worked 50% or less of the time. When we could afford it, we were very generous with giving full-time benefits to people who were working only part-time. You will not find that in the private sector. We are renegotiating, however, because it has turned out to be a huge personal burden on the part-time staff. And you will see at our meeting on Thursday an answer to this.
Ms. Vaillancourt.
I'm a little confused about some of the responses. and I'm sorry if I'm going to answer a different question than what has been asked. One of the things that is really important for people to understand is that the part-time workers who were slapped with this, I would say, egregious increase in their health benefits, in many cases will be actually having to pay our school system for the pleasure of working for us. And one of the things about that people don't understand is that they're called part-time employees, but they might be working the full extent of the position. Let's say a cafeteria worker whose position is only 4 hours a day, and that's the maximum that they can work. So they fall into the part-time category, but they're working, as much as they can. So I'm not really sure that we should, as a county, as a community, as a society, be balancing our budget on the backs of the most vulnerable, lowest paid people that we have in our community.